How's that shot look?
You look
Okay.
great.
Well, shoot, that's important. Thank you. You look good too. Okay, Madam Mayor, my first question has to do with what are the latest numbers? Are you encouraged, discouraged? What do you think?
Well, Bruce, we knew that May was going to be a month where we saw our peak of cases, and we still expect that to be the case. We have over 5,000 confirmed positives in Washington, D.C., and we have lost about 260 Washingtonians. So this is a serious disease. Washington residents and businesses have made a lot of sacrifices to keep our case count at this level. But it's important that we continue to practice very strict social distancing so that we can give our healthcare system the opportunity to serve people who get sick.
Yeah. Did you see the video from down the mall today as people were looking overhead, watching the salute? Uh, your thoughts? Did you see enough social distancing then, or did it bother you?
Well, I think what it shows is that people are antsy. They want to get out. They've been under a stay-at-home directive for now 6, 7 weeks. And we had a nice day after a lot of rain, and there was something really cool happening. Even given all of that and the very nice gesture that it was meant to be for our healthcare workers, what I would implore Washingtonians to do is to get some sunshine and exercise in your own neighborhood. You have a better chance at knowing that you can social distance and not be among a big crowd. Crowds are one thing that really concern us, among other serious things about the spread of this virus.
This is something that concerns me a bit. I thought, and I'm pretty sure I've heard, we're taking a regional approach to this. That as goes DC, goes Northern Virginia, goes the Maryland suburbs, and yet you look and you see Virginia's governor is giving every indication that come May 15th, he's prepared to open things up a bit. I haven't heard the same thing from you. I haven't heard the same thing from Governor Hogan. On the contrary. So where are we? Are we on the same page when it comes to opening things back up?
Well, I'm not sure what they're saying on the ground in Virginia. What we see is that every jurisdiction has rising case counts, and that the peaks of this virus in positive cases and in hospitalizations is yet to come. I think we've all managed to keep our cases lower, but that's because of strict social distancing. So we all want to get back to work and back to church and back to school and all of those things. But if we do it in a way that we can't support with testing and contact tracing, we're going to be right back to square one.
Are you concerned by what you hear that the governor of Virginia, it appears on May 15th, will be lessening the orders and allowing people out and businesses to open? Does that concern you? Right
I'm very,
across the Potomac.
I'm concerned about DC residents and DC government workers adhering to the stay-at-home policies in DC as long as our health professionals say that's what we need. So I am making very clear that DC residents shouldn't be doing any non-essential activity, essential work, essential exercise, food, medicine. No matter what jurisdiction you may find yourself in. And that goes double for DC government employees because we have many employees who are essential workers and we need them to be social distancing so then when they report to work, they aren't infecting our residents.
Not trying to get you into a verbal war here with the governor of Virginia residents, but what then would be your message to Virginia residents who are allowed out, who might want to come across the Potomac, into DC?
Well, we're going to keep and work with our businesses so that they can open up in a way that's safe. That they will have, and this is once all of the health indicators say that we can. But that's why we have an advisory committee that's advising us across 11 sectors about how these various sectors can open up safely. So what we know is you can open up a restaurant, but if the public isn't confident that you're taking all necessary precautions, that your employees have been appropriately screened, that they have the right protective gear, that you have a sanitation schedule. If we can't say all of those things in an orderly way, and if the government can't be there to support businesses to be able to do those things, then we know opening won't be successful.
You had said that May 15th you would reassess. We've also heard that we need 2 weeks of positive numbers. In other words, the increases, not happening. As we sit here and talk today, do you envision come May 15th that you might be lessening the orders, the restrictions?
Well, we're looking closely every day, Bruce. Here it is, May 5th, and I like to be able to give businesses some notice. I can say at May 5th, we won't have 14 days of decreases on May 15th. But I am, as I said, waiting for our health officials to give me some definitive recommendations around May 15th, and then we'll get that out to the public just as soon as possible.
So it's fair to say, though, you haven't decided at this point. You're not leaning one way or the other.
Well, I lean towards the science. And so when our medical professionals can tell us what our expectations are, really for the remainder of May, we'll be in a position to make more decisions.
Okay. Do we have the test kits that we need, and are we testing enough people at this point?
Well, we are gaining test kits every week. In fact, we have some new assurances from FEMA that they're going to give us more kits. But I think what's really important, Bruce, is that we are strategic about our testing plan and we're testing the right people. What we know for sure is that people who haven't been able to social distance because of their work, people who have been exposed because they're essential workers, healthcare workers, first responders, they need to be tested. And when we find a case, that person needs to be isolated, even from their own family, so that those cases aren't spreading. We also need to be very concerned about people who are vulnerable to very complicated cases with COVID-19. And that includes African Americans, that includes people with underlying conditions. We're seeing more and more infection among our Latino population in the district. And we've always been very concerned about our congregate settings. And those are nursing homes, senior living facilities, our DC jail, our hospital. And so we've been very focused on those things as well. So we've rolled out a series of new testing modalities in those congregate settings, including our homeless shelters, and we think they're having a positive impact.
That's a big group, a massive group you just outlined. And again, so I come back, are we getting to those people? Are you satisfied with where we are? Do we have the test kits to reach and test those populations you just mentioned?
So we have distributed a machine you probably heard talked about on the White House Corona Task Force, the Abbott machine, where we've distributed to DC jail. So the jail officials and the medical personnel at the jail can do a 15-minute test for any suspicion of COVID. The same is true for several homeless shelters. And the same is true for several of our senior living facilities. And so that is very, very important that we're able to identify the virus and isolate it in those facilities.
I'm still not hearing, and maybe I'm deaf. We're not there. I get the goal, but we're not there yet. Now, if that's the case, do we need more test kits?
Of course.
If we're not reaching those people, why not?
I don't know of a jurisdiction in the United States that doesn't need more test kits. And you've heard the national debate about what the federal government's role is in doing that. They've committed to giving us enough kits to get to 2% of our population, which is something. But we continue to use our own procurement power to try to get more kits.
Do we have any deals going? And by that, I'm going across the line now in Maryland. Governor Hogan, using his wife and her connection, her heritage in South Korea, comes up with 500,000 test kits for his state. I didn't hear him mentioning sharing that with DC or Virginia or anybody else. Have we reached across the line? I mean, or is that just unheard of or not practical? Could he or somebody else help us get what, say, the federal government isn't helping us to get?
I
That
don't
is
know that they
additional.
have what they need in Maryland. Like I said, I don't know that anybody has what they need with test kits. So what we're doing, what I'm sure of, is that we have the test kits to focus on our strategic populations. And I've mentioned those
Right.
essential workers, healthcare workers, grocery store workers, people who haven't been able to self isolate. We know when we see the virus contained in that group of people who go out every day, we know that we're seeing progress.
Most of the polls show that most people are not confident, are not ready to go back to work. Oh, they want to go back to work, and quarantine fatigue has certainly set in everywhere, but they're just not confident. How confident are you? How do you feel?
Well, we know that we don't have a cure and we don't have a vaccine. So what everybody recognizes is that if they're exposed to this virus and get this virus, that they could get very sick. And there's no cure. And so they would hope, and a lot of people, most people, in fact, are going to recover if they get COVID-19, but others could get very sick. And so if you ask me how confident I am, I have to be confident that when we find an infected person, we can isolate that person so they're not spreading the disease to another person. I also have to be confident that our hospitals can handle very sick people, and a lot of very sick people coming in at the same time. Because opening up the government or opening up the city means more and more people. We've been social distancing now. So we should be containing the virus. When we start mixing again, we have to be able to find the virus, isolate it, and get sick people help.
Okay. Somebody wanted me to ask you this. I want to shift gears a little bit. Two new hospitals coming up east of the river. Is level one trauma included in that?
Yes. So it's one hospital that is going to replace the United Medical Center, and Howard University, which is a trauma one hospital and teaching hospital, will build a new hospital that's also trauma one and teaching hospital.
Okay, residents of there got to be excited about that. How big a difference is this going to make?
Well, I think it's going to make a big difference for the whole city. And one thing I want to caution everybody about is every hospital in DC is for every resident of Washington, DC. Sibley Hospital is not for Ward 3 residents. It's for DC residents. And in fact, it serves the entire region. And the same will be true for our hospital on the St. Elizabeth's campus operated by George Washington Hospital. It's going to be a hospital located in Ward 8, but it's for everybody in Washington, DC.
Got that. Let me close with this. What is your message to city residents at this point? Quarantine fatigue has set in. People have been affected, up close by this. There's a lot of fear out there. What's your message to the citizens out there?
Well, my message is thank you, first of all, for adhering to guidelines and mayor's orders that have changed your life. But it's also saving lives in Washington, D.C. I would also tell them you should be very proud of your government, that people have pitched in, they're working hard, and they are, just performing in a stellar way. And I'm very proud of them too. And that's from everybody working on unemployment, to picking up our trash each and every day, to making sure that our buildings are being sanitized. So be very proud of what they're doing. But also know that our health department is top notch. They're giving me great advice about how to safely reopen the city and when to do it, as well as a advisory committee with Ambassador Susan Rice and former Secretary Michael Chertoff, who are very serious people who are making sure our 11 sector plan is going to support bringing our economy back in DC. And we'll get there together.
Madam Mayor, great chat. I'm looking forward to doing this again a week from today. Let's talk again next Tuesday. Is that okay with you?
Sounds good, Bruce. Thank you.
Take care.
All right. Bye.
All right.